How are you feeling today? Yeah. Still hurts a little bit in the head from that concussion. That's to be expected, so that should be completely normal at this point, okay? And you're finding you have a bit of a fever too? Okay. Well, we'll take a look at that as well when we're doing our quick examination, okay? Because we are going to take off the head bandage today. Oh, good. I'm glad you're excited for that. Okay, well, we'll get started. I'm just going to go over my chart here real quickly and just get some quick information off you. Sounds perfect. And can I just start with your full name, please? Okay, perfect. And can I get your home address? And that's with an E? Okay, perfect. Okay, and can I also just get a brief run through with the last doctor that you visited? I believe it was for your eye exam. Okay. I see. Okay, and they didn't come across anything at all? Nothing abnormal? Okay, perfect. Excellent. Okay, excellent. And last thing, can I just grab your telephone number, please? Okay. Okay. 45. Okay, excellent. All right, so I have all the information that we're going to need today. As I'm looking over your chart, this should be a pretty smooth and easy appointment for you, okay? Absolutely. I'll do my best to try and ail everything that inflicts you today, okay? Sounds good. Okay, so first I think we're just going to have just a look at the bandage wrap, okay? We're going to see what we can do with that. Because we are going to be removing that today for sure. Had you had any problems with having to replace the bandage? No, none whatsoever. Okay, good. Okay, well, I have my handy scissors here, and I'll be able to just cut open that one spot, but I do just want to check just under the bandage real quick before we do start cutting it off, okay? Excellent. So I'm just going to have a look here. I'm just going to move some of this bandage here. Oh, sorry if it gets in your eyes there. I'm just going to take a look here real quick. Make sure I don't see anything abnormal or anything that I should be concerned about. Okay. Oh, okay. Very well done. I'm going to check around the back here as well. Okay. So it looks like everything's fine. It's healing nicely. There's no visible scar that's left, so it looks very normal from that point. Oh, piece of that came off. Sorry, let me just wrap this around. There we go. And now that we have it properly wrapped, or properly situated back where it was, now I'm going to go to the part where the tape is, and I'm just going to give it a snip, okay? Here we go. Okay, that is that one piece of tape there. Now I'm just going to get this other one here. Perfect. Get these little pieces out of the way here. And now that I have the tape undone there, what I can do is take this last piece here and unravel here. And just keep unraveling here and here. Just keep unraveling it till there. Perfect. So let me just cut this last piece, a little tape that's just stuck. Okay, perfect. There we go. There we are. Okay, so everything, like I said, is looking great with that. It looks like it's healing perfectly. Now, you mentioned that you did feel you had a fever. Okay, so I'm just going to take this pen here, this temperature pen, and I'm just going to bring it just across your forehead here. Okay. A couple times it will take. Very good, very good. Scans the entire forehead and gives you a very accurate temperature here. Okay. Yes, yes. Looks like you. Yes, you are above average in temperature, the normal human temperature right now, so you do have a bit of a fever. Okay, so we're going to do our best here to try and bring that down, or at least give you the tools to bring it down, okay? Excellent, sounds good. I think I'd like to do, though, is just take a listen in on your breath as well as your heartbeat, okay? Make sure it's working here. Okay. So now, I'm just going to come in here. I'm going to listen to your heartbeat. I just want you to take a breath in and let it out normally, and then just breathe, okay? Okay, and I'm just going to have a listen on the other side as well. And just have a deep breath in. Perfect, and just let it out. Okay, perfect. So your heartbeat does sound a little bit irregular, but the breathing sounds good, which is exactly what we're looking for. The heartbeat might just be an indicator of the fever, kind of comparing the two. What's that? No, it's definitely not uncommon, so that's something to be expected. Yeah, absolutely. So what I'm going to do is just write that down in my chart here really quick, and then we will be able just to move on just to the kind of the next test that we're going to do with this appointment, okay? So we've had a temperature. Perfect, okay. We've got your temperature there and your records here with all the information we needed from you right here. Okay. All right, perfect. I've got everything we need there. So the next thing we're going to do is this will actually be able to test your eyesight, which so we can get an idea from the concussion itself if you're having any problems with light sensitivity or of any issues with the eyes at all that I can physically see or that you can feel or you're feeling the effects of. Perfect. So we're just going to use this. The temperature pen is also a light pen, which is fantastic because it works as a double instrument here. Okay, so the first thing I want you to do is just to follow the light just over here, okay? Follow it as best as you can with both eyes. And I'm just going to have a look at your eyes as you do so, okay? So just focus over here, okay? Good, keep focused on that light. Okay, okay, good, very good. Not seeing any abnormalities. Okay, look up here for me. Okay, good, very good. And just look down here for me. Okay, good. Everything looks good with that. And I'm just going to go over to this spot here. Come into your peripheral vision. Try and see it as best as you can. If you can't, just keep looking in that direction. I can still keep an eye on your eyes to see if there's anything that pops out for me. Okay, good. Good, keep following it. Keep following it. Okay, good. Okay, good. Very good. Okay, and now I'm just going to come on this side here and do the same thing, just and see it on the other side of you, okay? Okay, good. Very good, okay. Very good, okay. And I'm just going to get you to look just up at the top here. Perfect. Nothing abnormal there. And I'm going to get you to look down in this corner here. Okay, good. Nothing abnormal there. And I'm just going to get you to look over on this side as it comes into your peripheral vision, okay? Just keep focused there. And I'm going to keep looking at the sides of your eye and your pupils just to see if there's any reaction here. Okay, very good, very good. Follow. Follow the pen, follow the pen. Follow that light pen. Perfect. Okay, good. I'm not seeing anything. I think I see just a little bit thing. Okay, if you can look at just the light, just right up here. I'm just going to take a look just at your eye here. Okay, just here. Keep your eye just pushed to that light there. Focused on that light. Okay, good, very good. Oh, it doesn't look like anything too serious. Might just be strain from all the trauma that something like this accident would have caused, okay? Okay, perfect. Okay, now keep focusing. I'm going to just keep an eye on that one spot. And I would like you to keep an eye on this light spot here, okay? Very good, very good. Okay, excellent, excellent. Very good, very good. Okay, and you're not feeling any pain in that eye whatsoever? Good. Neither of the eyes? Okay, very good, very good. So it doesn't look like you're affected by sensitivity of light, which is good news, because we do have another treatment that comes in the form of a light in this pen. So this is basically like a little headache medicine, okay? Kind of helps with fever, headaches, pains, muscle inflammation, stuff like that, okay? We want to give that a try and see if it helps with your fever. Perfect. Sounds good. Okay. Now I'm going to be holding it at this angle and just coming across your eyes and moving my way up, okay? If it gets too bright, just let me know. Okay, are you ready? Here we go. Okay. I'm just going to come back and forth. Just back and forth. Back and forth. And it's just giving your eyes small doses of treatment here. Very good. And that's right, just keep your eyes open and allow it to take effect here, okay? Very good, very good, very good. Just like that, very nice. Very good. Feel free to relax as you're watching this go back and forth. And allow the medicine just to take over and help your fever bring it down. And any head pressure you're feeling because of that fever. Very good, very good. Okay, and then the last part of this, it'll come in a circle. There we are, and just close your eyes and we will just count to 10, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And if you'll open your eyes. Perfect. Does that feel a little better? Okay. It's usually pretty instantaneous. So what we're going to do now is use our little temperature meter here, and we're going to find out where you're at for temperature now, okay? Perfect. Okay. I'm going to scan this across your forehead here. Okay, it's scanning. Gets the whole spectrum. Gets a very, very accurate temperature reading. Okay, okay. Perfect, perfect. Okay. And you have a normal reading now. Do you feel a little less warm? Oh, perfect. Okay. I'm glad we were able to figure out a solution for you today for that. Because I know with after everything, that's the last thing you want to feel, right? Yeah. Okay. So we've done the eyes, made sure they're all responding to the light sensitivity. We've looked at the concussion. We've looked at your heartbeat as well. And I think we're just going to do one more test, and then I think I've seen results that we are looking for. Fantastic. Let's get started. Okay. So the last thing we're going to want to just take one quick look at is your hearing, okay? And see where that's at after this concussion as well, okay? So what I'm going to be doing is using this brush and brushing it on an item, and I just want you to tell me when that item stops brushing, okay? When you hear the sound go silent. Perfect, okay. So we'll just start just on each side here, okay? Very good. Okay, and we'll try again on this side here. Excellent, very good. And just again on this side here. Perfect. And just once more on this side here, okay? Excellent. Okay. So as it seems, your hearing is impeccable, and it seems like the concussion has had no effect on that whatsoever. Okay. So I think we have all the answers we're going to need here. Let me just jot down a few more notes here, just so we can say that we've dealt with your fever. Able to confirm with that the bandage it did its job, and it protected it to the point where it's no longer there anymore on your head. Perfect, and that we wrapped up the meeting with those few tests to make sure that all of those cranial nerves are in working order, okay? The other cranial nerve exams, from what I've seen, there has no reason to do those tests on this one, but if you do find that you are having issues at all, please feel free to make another appointment, and we will go over a full spectrum for the full cranial nerve exam. But other than that, you shouldn't have any other problems with that area, okay? Perfect. Thank you for double checking, though. I appreciate that. And now I just need to sign you out with the big doctor signature here. Okay, perfect. We are all set now. Do you have any other questions for me at all? No? Not a problem at all. Thank you so much for coming in, and I hope you feel better very, very soon. Oh, no problem. I'm glad you're already starting to. Okay, well, I will see you at the next appointment, okay? Alrighty, take care.